and we're here, and I'm welcoming my next guest, who represents how internationalized this conference is. Australian by birth, Glenn Bilby is now here, living now and working in Sweden as a very well-known entrepreneur. So, Glenn, just tell us a bit, why are you here and who you are?
Okay, so I'm an Australian sports scientist, physiotherapist and businessman. And I guess when I finished a senior executive job for another health tech company, I discovered I need to actually objectify testing in a clinic instead of just relying on people like myself to see somebody's posture and comment on how you look and what your problem might be based on your movement. We really needed to capture that information by using digital means. So I played around with all kinds of sensors. A lot of the sensors I was familiar with from the sports science world back in the 80s, and some new sensors that have come about more recently. And we discovered if we use something simple like a gaming sensor from Kinect, from Xbox, then we can get very good data about people's posture and about their movement patterns. And we can create a 3D image of that person and look at them in detail. Even a helicopter view, so we can see if the shoulders are twisted compared to the hips. The test was designed with me in mind. I have a busy clinic. I can see, 15 patients a day. And I don't have time to stand there and take 40 minutes to look at people's posture. I really want to know what angle is your neck, what angle are your hips, are your knees tracking in or are they tracking out? How do I explain your feet that are pronating and falling in? I want numbers for those things. And in the past, I've just been drawing little stick figures. So, when I've worked with elite sports teams in the past, we've had big, expensive laboratories. They cost millions of kroner to set up. You need to have a PhD to do all the testing, and you can test just a few people a day. That doesn't work in healthcare. So one of the challenges was, how do we take this fantastic technology and make it useful for people in a clinic? I know there's lots of great technology out there and some great inventors and some really good innovators that are coming up with good tech, but a lot of it will never reach people like me in the clinic because I just can't implement it in my day. It's a real challenge. So I'll give you one example. After we created the testing to look at balance, movement patterns and posture, I created a 15-page report full of all kinds of numbers, time in motion graphs, illustrations, and I showed it to my colleagues, very highly educated and well-experienced physiotherapists, and they said, I don't know what to do with this. It's too much information. And of course, me coming from a research background many years ago, I'm thinking, what? This is great. This is like this. This is like a child with candy. You could do so much with this. But no, it's too much. I can't cope with it. Just tell me what's wrong with the people and give me these basic areas.
And that's what you took for you as an example. You have to give a really meaningful data to the people.
Correct. So we need to give people something that's easy to implement, easy to understand, and easy to communicate to patients.
But I would like to mention one inspiring quote from you. I'm a physician, but I just started to play with these gaming technologies and experiment. For me, it's a very good sign. You're a physician taking innovations so quickly and adopt. But so what you're most passionate about when we are saying digital health? What do you imagine?
Everything's connected. I have a dream for QuickPosture, which probably answers your question. First, we need patients to be able to test themselves. So we set up the sensor, or the sensor is already in 2015 televisions, which is likely the case. So the smart TV's in the living room, and the person can stand in their living room and say, "Hello, TV, good morning." And the TV says, Dina, would you like to test yourself today?
Maybe.
Or automatically, when you're looking in the mirror sometime in the future fixing your hair, it will say to you, Let's look at your posture today, Dina. You're looking a little bit tired after that conference.
Oh, no.
So it tells you automatically that you need to act.
Yeah.
If you look fine, it doesn't disturb you.
Yeah.
It doesn't say anything to you. So that's phase one, that people, individuals, patients will be given information by technology that is useful and given at the right time. Too much information from everywhere at the moment. So let's take away all the unnecessary stuff and just give them stuff they need to know. The next stage would be to feed that information to health professionals in terms of digital health. And those health professionals are getting fed information from all different directions. So if I have a person who comes on my table with Parkinson's disease, I see that their posture's creeping forwards. There should also be a connection to the specialist who is monitoring their dosage for L-DOPA.
Okay.
If I have a patient with Parkinson's who's looking great, it should also report to the specialist that their posture's great, and the specialist can turn down their dosage. So that this machine-to-machine network and network of specialists puts the patient in the middle, and it just coaches all of the people in this ecosystem to manage the patient properly.
But great, thank you for the picture. And last question for you. What is most inspiring during these 2 days? What happened?
For me, I've lost my voice already because I spent all day yesterday talking to people, not just about QuickPosture, but about all kinds of things. And I've been talking about collaboration with IT companies and artificial intelligence, as well as clinicians, as well as people from academia. It's just a great cross-pollination opportunity.
Thank you and good luck. Hope to see you at Digital Health Days 2015 with
will.
the already launched product.
Yes, thank you very much.
Thank
I
you.
hope so too.
Good luck.
Thank you.
And now